Hello, my name is Charles Goldfarb, and I am joined by my co-host Alexander Aleem for the AOA podcast, Lessons in Orthopedic Leadership. We are incredibly pleased and honored to have a top medical leader join us today, Rear Admiral of the Navy Gillingham. He is also the Surgeon General of the Navy. Admiral Gillingham is a pediatric orthopedic surgeon by training, but certainly has treated and continues to treat patients of all ages, especially during his time in Iraq. He gave the AOA a wonderful Howard H. Steele lecture last week on leadership in challenging circumstances. And in this podcast, we are following up on some of these key topics in leadership. Welcome, Rear Admiral Gillingham.
Well, thank you. Really appreciate this opportunity to talk with you today.
All right, outstanding. So I'll start. We have a few questions we'd love your responses to, and these can be as interactive as you like, but we look forward to your experience and sharing that experience. So the first question, in your Howard Steele lecture, you mentioned several leadership books, such as Managing the Unexpected, which is on the fundamentals of high reliability, Jim Collins' book, Good to Great, which emphasizes having the right people on the bus and in the right seats on the bus. And we were curious if you'd like to expound on either of those or additional books on leadership that have impacted your career.
Yeah, thank you. Like I'm sure both of you, I'm an avid reader. As I made the transition to leadership and management type positions, I recognized that I could benefit from reading some of the highly rated books in that area. And of course, Good to Great is really one of the gold standards. And I have found the concepts, that Jim Collins introduces in that book to be highly valuable. And I mentioned, of course, you mentioned the right seat, right bus. I think the other really powerful aspect that is memorable for me from that book was the Stockdale paradox. It resonated with me as a fellow naval officer, but the idea that he, as he recognized that he would be a prisoner of war, was able to balance the optimism of ultimately being released from captivity with the ability to recognize his brutal daily reality. And I obliquely mention that in the Steele lecture, in the sense that I think high reliability organizations have the courage to face where they're not where they need to be. And the example of the hypothermic patients that we sent to Baghdad was an illustration of that. And I was proud of the team that we immediately recognized that we had to fix that. So Good to Great, of course. Managing the Unexpected, I think, is probably, if put on a desert island and only given the opportunity to have 2 or 3 books, those would be the ones that I would take, and those are the ones that I most frequently share with emerging leaders. There are 3 editions, but their discussion of high reliability and high reliability behaviors matures through the 3 books. So I have recommended to those that I recommend the books to read them in order. The first is really the fundamentals of high reliability, and really the 5 principles or characteristics that they describe, to include anticipating failure, the deference to expertise, a real focus on operations. And then as the books progress, and they're a great read, they're only about 200 pages each, and they have great examples of how organizations faced difficult challenges, either successfully or not so successfully. And there are some examples, for nuclear power operation, for example, aircraft flight deck, which is a very complex, dangerous environment. And then the most recent book really talks about, and I think when you read them in order, really lays out some of the practices and behaviors to get after what they call mindfulness, not in a Zen sense, but in the sense of having everybody on the team engaged. And we know that complacency is the enemy of high reliability. So practical ways to engage the team and to stay mindful about what that organization is doing. And then the third book, if you will, of the triad for me is a book that I found tremendously useful as in terms of learning how to be a manager. And it's called First, Break All the Rules. And it was actually done by the Gallup organization. There's a new edition that's just been out, I think, in the last year or two. But it was a detailed survey of 80,000 managers in highly successful organizations, and it really was eye-opening to me. And they actually surveyed the most successful managers, and they actually approached their management of people in a very counterintuitive way. For example, we're always taught that an effective manager needs to pay attention to those who aren't performing quite as well to bring them up to a standard. In this book, they mentioned that the most successful managers spent the majority of their time with their most successful and able people. Also talk about there's a significant discussion about strengths and how to identify strengths in individuals. And I've found that, as I indicated in the Steele lecture, to be very valuable. And it boils down to really spending the time with someone, asking them open-ended questions and finding out what really comes naturally to them. It seems pretty self-evident, but frankly, I don't know that we do that, particularly in medicine, very well in interviews. We certainly always ask about strengths and weaknesses, but this approach is to ask those open-ended questions and say, what are the activities that you do that you look up and realize that a couple of hours have passed, and those are the sorts of things that identify an individual's strengths. So there are many other valuable parts of that book, but those are the things that I find myself most referencing when I have conversations with people and with those who are becoming new leaders and managers.
Admiral Gillingham, it's really an honor to talk to you. Based on what you just mentioned, you mentioned in your lecture and just now, kind of asking open-ended questions during the interview process to help assure that you understand an applicant and their strengths. And maybe we don't do the best job of that in medicine. Can you provide some examples of some of the questions you find most helpful during interview processes? Well,
the one I just mentioned, and by the way, Dr. Aleem, I apologize. I just recognized that your title, so I apologize for not acknowledging that earlier. But what comes naturally to you? Given a day off, how would you spend that time? And then questions like, would you prefer to be, working on a task by yourself, or would you prefer to be doing that with others? And so, kind of sideways opportunities at looking at some of those skills that we prize in medicine, teamwork, for example. But what's interesting to me is that I often find those who are introverted often are much better at the types of tasks that we ask orthopedists to do. And so with them, it's the challenge is teaching them the skills to build the team around them that will allow them to succeed. So, I think that another really effective question is, tell me about something that you're most proud of, and then just stopping there and listening. And I think you can gain a lot of information about the individual and their strengths in that way.
Those are great questions, and it's so timely because Alexander and I, amongst many others, as you know, are trying to figure out what residency interviews and fellowship interviews are going to look like in the coming year, especially being remote. And so trying to best understand the applicants and allow them to share who they really are with us is just an incredibly important goal for us. So those those all resonate. Thank you. I am going to, with your permission, read the key points from one of your slides last Wednesday as an introduction to a question. And so one of your slides was what I learned in Iraq, and you had a few points, and I'll just read through those because they're each incredibly important. And I think the audience will appreciate hearing them again. So motivate your team around a compelling mission, clarify the way forward, create a framework for behaviors and actions, your culture, identify and foster individual strengths, demonstrate mutual respect and ensure psychological safety, face the brutal facts and insist on rapid cycle feedback, defer to expertise, and celebrate even small successes. So a wonderful series of key lessons for an effective team. And I guess I would ask, you shared your experiences in Iraq, which were compelling. And the hypothermia example is a wonderful example that got to some of your key points. I guess it raises the question for the civilian surgeon. How can we understand both our own leadership potential and how we can also develop that leadership potential in others? Because we're not in those same situations. Do we need to create a high stress environment to best understand, or can you do that on a day-to-day basis? I know that's not an easy question. It's a lot to ask, but I didn't know if you had any basic thoughts around leadership development in a civilian environment.
Yeah, thank you. That's a great question. Frankly, taking care of an individual in the OR is a very as we all know, a very stressful situation. So I think modeling the behaviors in the OR is a great place to start. I'll tell you, and it's one of the reasons I got very interested in this is patient safety. And as the commanding officer of a naval hospital, I was also one of the orthopedic surgeons, and so I would go to the operating room. And of course, in the military, when the commanding officer walks in, everybody puts everybody on guard. And so I tried very hard when I walked into the operating room to say, listen, guys, I'm Dr. Gillingham right now. I'm not the skipper. And hey, I need everybody's complete focus and best efforts to take the best possible care of this patient. And I need your help because I was just in a budget meeting for the last hour, and I need you to help me get locked in and ready to go here. And so I think that's an example of really sharing, that concept of high expectations for the team, mutual respect. Hey guys, we're all part of this. The focus isn't on me. The focus is on the patient. And I think that gives the team that permission to speak up. And I do say, I would routinely say that if you suspect that I'm heading off in the wrong direction, please speak up. And I would have our surgical technicians who are corpsmen. I would come in and do the usual exam of the well leg first, and I would have every once in a while a corpsman say, "Excuse me, Dr. Gillingham, but I think you're getting ready to work on the wrong leg." And then here I think is a critical element, is if even though I knew that I was examining the well leg prior to examining the injured leg or the operative leg, I would stop and say, "Thank you," and explain. Just so you know, routine is we always examine both legs, and I start with the well leg. But man, I really appreciate the fact that you spoke up, and please continue that. And to get to that psychological safety piece, when an individual would say something, suggest something, and be wrong, I think the tone of the leader is critical there. Because if that individual is humiliated, they will never speak up again, at least while you're in the room. And so I think a great place to start, even as junior residents, is in the OR setting, and it might be the minor room, doing smaller cases, but to really practice those behaviors and stopping. I think the preoperative huddle that is part of team steps, which I mentioned in the steel lecture, is critically important. But in that time, really setting those expectations that you want them to speak up, you value their opinion, and you aren't going to humiliate them if it's wrong, but you're going to say, man, I am so glad you're engaged and paying attention. In this case, yes, you're right. It might appear that that's the wrong thing to do, but here's why it is. But man, stay with me. You're really gonna help me as we take care of this patient.
I love that, and that is, I know Alexander and I have talked about that philosophy, and certainly it's a basic safety principle of the stop the line, so to speak. And there's lots of different nomenclature around it, but it really does resonate to create that environment where everyone feels safe and appropriate speaking up. Because honestly, we're all fallible, right? And so this can help keep us out of trouble. So that's fantastic.
I believe, Admiral Gillingham, you're the first orthopedic surgeon to be the U.S. Navy Surgeon General. So what advice would you have for orthopedic surgeons looking to become leaders in their organizations?
Yeah, that's, I was surprised to find that out, but that is true. And I'm proud to be in this position. I would say that I think as orthopedic surgeons, we're just naturally problem solvers. And I'll tell you, my leadership journey started like for many, I'm sure. My department chairman, when I came back to Naval Medical Center San Diego as a staff, said, "Hey, I think it'd be really beneficial if you got on the risk management committee." And so, okay, but that's going to keep me out of the OR. No, I really think you're going to find some value in that. And so I went to the first couple of meetings and realized there was tremendous opportunity, like in any hospital, to raise the bar. And so once I saw that that energy that I was putting in was producing change in the hospital, I realized, wow, this is. He was right, and I had a very, very good mentor. My department head really was way ahead of his time in terms of patient safety concepts, et cetera. But I think he saw that given the right environment and opportunity, that would actually surface perhaps some latent leadership tendencies. So I think, going back to the strengths, I think as program directors, department heads, et cetera, knowing your staff, knowing your residents, that you can identify opportunities for them based on what you perceive their strengths to be, to contribute, and then that natural problem-solving mindset of ours kicks in. So once I realized that committee meetings didn't have to be wastes of time, that we could make progress, then I really started to realize that could be time well spent.
And what that's fascinating. So risk management is where it all started.
I just still, yeah, you find value in committee meetings. I have to take that with me next time I get assigned to a committee. So,
but we assume that the lesson is you engage in what you've been assigned to do, and each such assignment is an opportunity. And what was the next step? I think that your leadership journey will fascinate all the listeners. So you went from risk management, and what was next?
I never became a department head. Our director, what we call director of surgery, I guess what would be called chief of surgery, that position opened, and the same mentor, my department head, said, "Hey, you really ought to think about this. You enjoyed really trying to improve the level of safety based on the risk management committee. I think you're ready to at least interview for that." So the first year I did interview, I was a commander. They chose a more senior captain, and the interview process was valuable. And he debriefed me. What'd you learn? How would you have approached it differently? It turned out that I had actually, in preparation, I had kind of thought through some concrete steps that I would make in the surgical department, but the questions that I was asked, I didn't take advantage of the opportunity to just, even though they weren't directly related, to just go ahead and volunteer that information. So the next year after that individual actually ended up retiring and moving into the civilian sector. So the opportunity came again to interview. And so this time I spent quite a bit of time thinking about some very specific changes that I would make. You know, I spent some time thinking about what the commanding officer of the hospital, what his goals were. So this time I did not hesitate to share some of those, and I actually had some written proposals. And so that time I was chosen. And then about a year in, I was enjoying that. I enjoyed being in a position where I could continue to improve and influence the organization, but I still got to be a surgeon. You know, added some hours to my day. But then in the middle of that, Iraq happened, and I realized, as I described in the Steele lecture, realized that that leadership really was something that was very fulfilling to me. That's an extreme example. I think I would have continued to feel that way as the director of surgery at Naval Medical Center San Diego. And then based on both of those experiences, I was chosen to be the deputy commander at Naval Medical Center Portsmouth. And at that point, I really kind of moved into what we call executive medicine, and then was able to be the commanding officer in Jacksonville. And then, fortunately, a few years later, was chosen to be an admiral or flag officer. And this is a point that I would make, just as a shameless plug for the Navy. One of the advantages that we have is that we can try on jobs or try on positions without really having to make a significant change in our income or our career path. So when I was deputy commander at Portsmouth, I had a vascular surgeon who was our director of surgery, did a great job for 2 years, but at the end of the 2 years, he said, "Hey, this was great, learned a lot. I want to go back to the OR full time." I said, "Thank you very much. Good luck." So I think it may be harder in the civilian world to try on some of those things. But I guess the advice there would be, to the extent that you can, try those things on and see if it fits. For me, it fit, and I was able to get increasing scope of responsibility, and very privileged now to be the head of the organization.
I think you make a couple of very interesting points. The first is regarding the initial interview for the director of surgery position. And the 2 points I'm going to take away from that are, one, you didn't wallow in not being chosen, but you took away something from that opportunity, and you came back stronger for the next interview. And you also, I think that's a life lesson regarding how interviews work. And if there's any applicants listening, it's really important. You have to, during the interview process, you have to get your points in, and you want to answer the question, but we each are different in how we approach things, and we need to fulfill the interview questions and give the interviewer more. And so I love the way you said that. And then I've been thinking a lot about what you said for the formal lecture with the right seats on the bus. And I think you just hit on that again with, you may have more opportunities in the military background to try things on, but even within each of our own organizations, finding people the right way they can help our organization just seems incredibly important.
Yeah, no, thank you. Absolutely. And again, as I said in the Steele lecture, we don't really get to choose, who deploys with us. And so I think that time that I spent really trying to understand people's strengths, particularly, our Chief Petty Officer, Chief Duggar, that was incredible. That was time that was incredibly well spent. So to the extent, in a given situation, that you can spend that time and get to know folks and at least align them, to the extent that you can, the best with their skills and the requirement. I always when I'm explaining this, particularly to our more junior folks, I just Sister Act, the movie. There's a great scene where the choir sounds terrible, and Whoopi Goldberg rearranges the folks, and all of a sudden they sound terrific. And so, very simplistic example, but that's how I kind of view it. People have strengths, and finding where they best fit is the secret.
Those are fantastic points, and I think that was one of the biggest things that I took was sort of finding the right seats on the bus. I'm going to change gears a little bit, and we do really appreciate the time you've taken. Obviously, we're in the middle of a global pandemic, and you mentioned high reliability, teams that you use. In what ways have you used these principles of high reliability during the current pandemic to help with your mission?
Yeah, that's a great question. I mentioned, in the lecture that, we had probably the largest single concentration of an outbreak aboard Theodore Roosevelt, and it would have been, I think, easy just to say, hey, this is just too hard, and we'll do the best we can. But we really practice rapid cycle feedback. So we didn't come up with the solutions right away, and they evolved. As we gained knowledge of the behavior of the virus, as we understood what capabilities we had or could bring to the situation. And that was continuous learning, on the fly, working with our fleet surgeons and our line officers and crews aboard TR. I will say that everything we learned there, we were then able to apply to how we operate all of our other ships. And we had another large outbreak underway, and that was aboard one of our smaller ships, the USS Kidd. But what was gratifying there is that the outbreak would have been much bigger had the corpsman, independent duty corpsman, who was the senior medical representative aboard the ship, had he not had some of the guidance that had been developed as a result of our experience to that point. And so he was able to consult that guidance, recognize that the symptoms that he was seeing, although atypical, were consistent with COVID, and then really start isolating and quarantining. And they eventually got to the point where they just didn't have any additional space to do that, and so they had to come in. And as a result of that experience, we developed a commander's, with our line officers, a commander's decision matrix, so that they know whether they can continue to operate at sea or whether they need to get to the closest port or seek medevac of the crew members aboard the ship. So the rapid cycle feedback would be probably the foot stomp there. I think there's deference to expertise is also illustrated. I've got, we do force health protection, as we call it, every day. This is an extreme example of that. And so I have Navy Marine Corps Public Health Center down in Norfolk, Virginia, that has experts in epidemiology, public health, infectious disease, among many other specialties. And so I was on probably 2 to 3 times daily phone calls with the commanding officer there, who in turn was reaching out to his subject matter experts and getting that information. And then we established a scientific panel, and I met with them again once or twice a day. And so I had a microbiologist, I had a laboratory officer who understood the ins and outs of PCR testing and the different capabilities of the machines, infectious disease specialist, preventive medicine, and public health experts. And so we really pulled together an ad hoc team of experts. So I think that's, and I'll just say that as we look at our organization, from some of those process things that we've learned. Tomorrow, actually, we're going to do a discussion of how can we incorporate that into our daily business. We won't run at 110%, after this crisis is resolved, but there's a lot of process and high reliability behaviors that we've practiced that I want to hardwire in the organization and take the next step.
Fantastic. Well, Rear Admiral Gillingham, this has been outstanding, and I believe our listeners will appreciate the follow-up to your wonderful lecture, the Howard H. Steele lecture last week. I would close with a couple comments. First of all, thank you for your service. And it feels like the Navy is very fortunate to have you in a leadership position, especially at this challenging time. And on behalf of Alexander and myself, thank you for sharing your leadership thoughts. We will incorporate much of what you have said into our own burgeoning leadership opportunities.
Well, thank you again for the opportunity. I consider it a true privilege, given the stature of the American Orthopaedic Association, to be asked to share this. Certainly, the experience that I have, and I guess I would only add one thing, and that's I think we, in addition to high reliability behavior, we seek to be an organization that practices high velocity learning, and so that probably the key thing, and I mentioned it in the talk, but I would just highlight it again. If I am to look back on my career, I think two factors have probably been among the most valuable. Number one, I think understanding that humility is not thinking of less of yourself, but of yourself less. There have been many authors that have been quoted saying that, but I think that, and that corresponds to the Jim Collins level 5 leader, really focused on benefit to the organization. And I have found that when I have done that, any personal gain is much amplified by that focus. And then the other is just the power of listening. And I think I've indicated when you interview, spending more time listening to the candidate than talking at them. Early in my career, I was guilty of doing that. I've learned to just ask the right questions and listen. So I think those are two key things that I would share as opportunities for future success for the membership. But again, tremendously honored to speak to you and have this opportunity.
I think those are some great final words. And again, I echo Chuck's sentiment. Thank you for your service. Thank you for being just an exemplary model of leadership. I'm going to take a lot of these principles of high reliability behaviors and high velocity learning into my own life. So Admiral Gillingham, it's been an absolute honor to speak with you. Thank you again.
Oh, my pleasure.